Hi guys, welcome to Photizomed YouTube channel. Today we'll be talking about joints. So we'll be talking about the definition of joints, the classification of joints. So the classification can be based on the range of motion, that's functional classification, can be based on structural features, that's based on the type of material that articulate the bone, can be based on shape or type of movement department, that's anatomical or mechanical classification of joints. So starting with the definition of joints, joints is actually the union of two or more bones. So joints are unions of or junction between two or more bones, and there are about 360 joints in the human body. And the study of joints is called arthrology. Arthro means joints. It's a Greek word that means joints. Then logy, that's study. So study of joints is arthrology, and the joint is actually also related to a Latin word called articulare and junctio, both of them meaning joining. Articulare means to divide into joints. So you can see the image here, image of different type of joints. We'll be talking about every type of joints that we have. So starting with the functional classification, remember we said there's functional, structural, and anatomical classification. So starting with functional classification of joints. So the functional classification of joints is actually based on how much movement they permit. So we have three types of joints based on functional classification. That's based on how much movement they permit. We have synarthrosis, amphiarthrosis, and diarthrosis. So synarthrosis actually is immovable. They don't allow movement at all. So stability, they offer stability over mobility. So the examples include the skull sutures, the gum fossils, and then we have amphiarthrosis, that's slightly movable, and they offer stability with controlled flexibility, like the pubic symphysis, the intervertebral disc. And then we have the arthrosis, which is freely movable, and it offers mobility over stability. So you can see the image of a synarthrosis here. So gum fossils and sutures of the cranium. And then next you have amphiarthrosis, the intervertebral disc and pubic symphysis. And then next you have the arthrosis, that's shoulder joints and hip joints. So talking about the structural classification now, so that's the most fundamental anatomical classification. That's the most fundamental. So it's based on the material connecting the bones together. So in the case of fibrous joints, fibers are actually connecting it together. I mean ligament fibers. And then cartilaginous joints is cartilage that is joining the bones together. And then in synovial joints, you have the synovial fluid, the synovial capsule, the synovial membrane. So the fibrous joints are actually synarthrosis. They don't allow movement at all. So they are immovable or immobile. And then cartilaginous joints, the amphiarthrosis, they are just slightly movable. And then synovial joint are the arthrosis, they freely move. They offer mobility over stability, like the hip joint, shoulder joints, interphalangeal joints, different joints like that. So it's talking about the fibrous joints. The connecting material in fibrous joints is the dense fibrous tissue, and the joint cavity is absent in fibrous joints. The amount of movement in fibrous joints is limited or dependent on the length of fibers uniting the articulating bone. There are three types of fibrous joints. We have syndesmosis, those are bones connected by ligaments. For example, distal tibiofibular joints is an example of syndesmosis. Then we have sutures. You can find them between the skull bones, so like the coronal suture, the lambdoid suture. So those are examples of fibrous joints. And then we have gum fossils, which is peg in socket, like the teeth in the alveolar socket is an example of gum fossils. So three types of fibrous joints: syndesmosis, sutures, and gum fossils. So you can see the image here. You can see sutures, you can see syndesmosis, and then gum fossils. So talking about cartilaginous joint now, the connective tissue in cartilaginous joint is cartilage. So it can be hyaline cartilage or fibrocartilage, and then there is no joint cavity, it is absent. And the amount of movement is dependent on the thickness of the cartilage. Take note of that. It's dependent on what thickness of cartilage. And then there are two types of cartilaginous joints. We have synchrodosis and symphysis. Synchrodosis is actually where the bones are united by hyaline cartilage, like in the epiphyseal fascial plates in the first sternocostal joints. So those bones are united by what? Hyaline cartilage. And you can also call them primary cartilaginous joints. For symphysis, those the bones are united, they are united by fibrocartilage. For example, you have the pubic symphysis, you have the intervertebral disc. So those are called secondary cartilaginous joints. So you can see the images here. So you can see intervertebral disc, you can see the pubic symphysis or symphysis pubis. So next, we are talking about the synovial joints. Is the most common and functionally complex joints. Most common and functionally complex joints. So the connective tissue is the synovial membrane, the joint capsule, the synovial fluid, the articular cartilage, and the joint cavity is present in synovial joints. Synovial joint is the only joint, the only type of joint that has joint cavity, and the amount of movement is dependent on the shape of the articulating bone. It's dependent on the shape of the articulating bone. So these are the images for the synovial joint. So you can see the articular cartilages, you can see the joint cavity, the fibrous capsule, the synovial membrane. So let's take them one by one and talk about them, and that will lead us to the last classification of joint, the anatomical or the mechanical classification. So this is based on the shape of the articulating surface and or the type of movement they permit. So there are six major types of synovial joints. We have the plane joints, hinge joints, saddle joints, condylar joints, ball and socket joints, and pivot joints. Here is a mnemonic to help you remember the types of synovial joints. Please help Peter carry some bags. So the please stands for plane, help stands for hinge, Peter stands for pivot, carry stands for condyloid, some stand for saddle, and then bags for ball and socket joints. So we'll talk about each of them now. So starting with the plane joints. So the plane joints allow gliding or sliding movements in the plane of the articular surface. So the articulating surface in the plane joints are actually flat. So the opposed surface of the bone, they are flat. So with movements limited by their tight joint capsule, there are also a lot of ligament that surrounds plane joints. So they are numerous, but they are always small. Plane joints are numerous, but they are nearly always small. So examples include the proximal tibiofibular joint, the intertarsal joint, intercarpal joint, intermetacarpal joints, carpometacarpal joints, sternoclavicular joints, acromioclavicular joints. So those are examples of plane joints. So this is the image. You can see acromioclavicular joints. You can see the intermetacarpal joints. You can see the diagram for the plane joints. So next, talking about the hinge joints. Hinge joints is uniaxial, and so it allows movement in just one axis, in just one plane, around a single axis and in just one plane, which includes flexion and extension only. So the articulating surface in hinge joints, the joint capsule is thin and lax anteriorly and posteriorly. That's because it's flexion and extension. However, on the lateral sides, you have what? Collateral ligaments. They are very strong. So they are holding the bones together on the lateral side. While anteriorly and posteriorly, the joint capsule is thin and lax. So examples of hinge joints, you have the elbow, the knee, the ankle, and the interphalangeal joints. So next, you can see the picture of the knee here. It's an example of the hinge joints. So next we talk about the saddle joints. So these are actually biaxial. They allow movement around two axes at right angle to each other. So the movements include flexion, extension, abduction, adduction, and circumduction. So saddle joints are biaxial. They allow movement in two planes, sagittal and frontal. So the articulating surfaces are actually shaped like a saddle. If you have seen horseback, so that's the way the saddle joint is. So there's a reciprocally concave and convex. So one side is concave, the other side is convex. So those are the two articulating surface. An example, you have the carpometacarpal joint of the thumb and the joint between the femur and the patella. So that's patellofemoral joint. So this is the metacarpal joints. So you can see it's the um, carpometacarpal joints is a saddle joint. So moving to condylar joint is also known as ellipsoid joint, and it allows movement in two plane. So the movement in the sagittal plane is actually freer than in the other plane. So there are two major movements that occur with that: flexion and extension, but also allows what abduction and adduction. So take note, condylar joint is what is biaxial. So the articulating surface, there are two convex condyles articulating with two concave condyles. So that's the articulating surface, and the shape of the articulation is ellipsoidal. For example, you have the wrist radiocarpal joint. The ulnar does not articulate with the carpal bones. Take note of that. Ulnar does not articulate with the carpal bone. The wrist is only formed by the articulation between the radius and the carpal bones. So you have the metacarpophalangeal joint, you have the knee joint, the atlantooccipital joint. So the metacarpophalangeal joint, that's the knuckle, and the knee joint is the tibiofemoral. So at the knee also, the fibula does not form part of the knee. The knee is only formed by the articulation of the tibia and the femur. So moving forward, you can see the images of the ellipsoid joints. So interphalangeal, metacarpal, so those are condylar joints, also known as ellipsoid joints. So talking about the ball and socket joint now, it allows movement in multiple axes and planes. So it allows flexion, extension, abduction and adduction, medial and lateral rotation, and circumduction. So that means that was ball and socket joint is multi-axial, and the articulating surface is a spheroidal surface that is fitting into a socket. So it's more like a globular head fitting into a cupped shaped cavity. So that's the way ball and socket joint is. And we have two major examples, that's the shoulder and the hip joint. Shoulder and the hip joints. So you can see the image here for the hip joints. So you can see the head of the femur articulating with the acetabulum of the hip bone. So pivot joints now. The pivot joint is actually a uniaxial joint. It only allows rotation around a central axis, and the articulation is between a rounded process of bone that rotates within a sleeve or a ring. So for example, when you talk about the superior and inferior radio-ulnar joints in the atlantoaxial joints, so those are the examples of the pivot joints. So you can see the pivot joint, so that's the annular ligament surrounding the neck of the radius. So moving to the structural class now, characteristics, types, and mobility. So this is more like a summary of what we have spoken about. So you have the fibrous joint that is united by collagen fiber, and then types, you have suture, syndesmosis, gomphosis, and then the cartilaginous joint united by cartilage. You have two types, synchrondosis and symphysis. Then synovial joint it is formed by the articular cartilage enclosed within a capsule lined with a synovial membrane. So you have six types: the gliding or plane joint, hinge joint, pivot joint, condylar joint, or ellipsoid joints. Then you have saddle joints, ball and socket joints. So a quick question just to revise what we've done. So which of the following is an example of a cartilaginous joint? A. Humero-ulnar joint. B. Middle radio-ulnar joint. C. Intervertebral disc joint. D. Cranial sutural joint. E. Tibio-talar joint. So what's the answer? Intervertebral disc joint. That's correct. So the next question: which of the following synovial joint types permit multi-axial movement? A. Pivot. B. Ball and socket joints. C. Condylar joints. D. saddle joint. E. Hinge joints. What's the answer? Ball and socket joints. That's correct. So next, thank you for listening. Subscribe, like, and share.